Welcome, everybody. Thank you again for spending your Sunday evening with us to prepare for your future. For your big MMI. Congratulations on getting your interviews at the University of Manitoba. So let's begin. Today's presentation is going to focus really on MMI preparation and the interview day. So we have a lot of presentations throughout the year. However, today's is going to be focused on this. And a little bit about me as your presenter. My name is Kevin. I reapplied to medical school, and y'all feel free to ask me as many questions as you want. I applied to medical school once. In the first year, I got 2 interviews. The second year, I got 9 interviews, but that was across both Canada and the US. First year was just Canada. I've done 6 MMIs. They've been at McGill, and I've seen every kind of MMI there is to see. And right now, I go to the Mayo Clinic Alex School of Medicine. So the Mayo Clinic is the #1 hospital in the world. It's in the United States, in Minnesota. So that's where I am right now. And the focus of this presentation really is to understand the difference between great answers and extraordinary answers. Okay? Keep this in mind. Now, the format, I'm not going to bore you too much because I know you have the emails, but it's a modified MMI specific to Manitoba issues. This is a major point. And it's asynchronous. So it's like your Casper, where you took it and you record yourself, and well, that's about it. There's no one looking at you to see, to give you a funny look or whatever. If you're saying something weird, you say what you say, and the video gets sent off into the cyberspace. And a few months later, your future is determined. And the format is there's a prompt or like a question stem. You have a minute to read it. You read the first, and there's like sub questions, right? Exactly like the Casper. In this context, so you have 2 minutes to read, 2 minutes to answer, but then it gets weird because then you have 3 minutes to answer for the latter 2. So this is the format, and there's 6 prompts total. Okay, so in a nutshell, it's very similar to the Casper. And there's a Zoom. You've been sent the link. There's a Zoom every year where Manitoba itself talks about different issues and things that you should focus on. So pay attention to that Zoom. And really, what it looks like with Manitoba is there are these topics like colonization, generational trauma, which is because of the residential school system, the social determinants of health, indigenous health, mental health, medical assistance in dying. There are these topics that they will tell you, these are important topics to read up on. They might even send you materials. And this is something that you absolutely should do, okay? But here's where I start thinking, okay, who are the great interviewees, which is you, and who are the excellent or the extraordinary interviewees, who are also you, but I mean the interviewees are the people being interviewed. And you have to think outside the box. So for me, when I was preparing for my MMIs, and I did many, you have to look, several steps beyond just medicine. You have to look at public health, so that's a big word for you to remember. And don't worry about screenshotting anything. These are all going to be sent to you. These materials, this PowerPoint will be sent to you right after this presentation. You have to think about, international medical graduates. There's a shortage of physicians in Manitoba, right? What are some ideas that are being thrown around of having these, you have physicians from like Asia. How can we use their skills? It's a neurosurgeon, but now they're working as, in retail. How can we use their skills? What are some pathways we can do to use their skills and address our physician shortage? You need to understand what are recent bills in Manitoba, okay? Even bigger, like cancel culture, the wealth gap, public versus private schools, immigration and refugee health. There's a lot of immigrants in Canada as a whole. AI in healthcare, okay? This isn't the time to be like, oh, I'm not good with technology. I'm not going to learn any of this. You should start learning a little bit about AI in healthcare. This is the future of medicine. It's going to revolutionize everything from diagnosis to treatment. Even to patient interactions. So these are things you need to think several layers beyond just the medical shell and look at society as a whole. So I believe the best way to learn in this 1-hour session that we have is always with practice. Okay, and if I'm going too fast, just feel free to stop me. Blurt out a question. This is super, super relaxed environment. So let's do this. Let's do this question together. Imagine you are a physician and you encounter a patient with chronic pain who requests opioid medication. How would you balance the need for effective pain management with the risk of opioid addiction? All right. This is a question that directly ties into the opioid crisis that is affecting Manitoba and is affecting, many metropolitan areas in Canada as a whole, especially even non-metropolitan areas in the territories. So once you all have read this, okay, someone just joined. I think it was Maxwell. So I'll let you briefly read this. Well, you can read it on the next slide too. A great answer to this, okay, maybe even better than one you might have right now, goes like this. So you would first conduct a comprehensive assessment of the patient's pain. Is it like, does it radiate? Where does it start? How, all of these things. You don't have to go into that depth, but you can just say, I do a comprehensive assessment. You'd have open conversations with the patient about their pain experience and treatment history. If opioids are necessary, then you could say, I would proceed with caution, starting at the lowest dose to avoid dependence. Then you could say, I would revise the treatment plan with the patient periodically, which means you regularly review it and adjust as needed. This is a very, very mature answer to this question. Does anyone find any problems with this question? Like just with this answer? Raise your hand. Is there a problem with this answer? Yep. Deepo?
I guess like I was thinking, like with the pain evaluation, I would just evaluate to see like what kind of pain it is and if it's even a type of pain that opioids are necessary for, because some types of pain you don't actually need opioids for. That's what I was thinking.
Beautiful. Certainly. And with a perspective like that, it even shows that you've been reading up on this or you've had patient experience to understand that. And this would be part of what you could elaborate here on the comprehensive assessment of the patient's pain and understanding if opioids are necessary. But here's the difference. And now we're going to talk about how to give extraordinary answers, like I alluded to in the early slides. Now imagine you say the same thing, but you also add, you could first explore a multidisciplinary approach to treating pain. Maybe if the individual's in pain, maybe you could talk about physiotherapy, lifestyle modifications, exercise, diet. You could talk about these CAN-MED roles. So I'm sure you've written your CASPR, you've done your applications. I'm not going to re-explain CAN-MEDs to you like these other people will, but you could say, I would educate the patient about the risks of opioid use and how we can minimize them to build a trusting doctor-patient relationship. But don't stop there. This is where the great applicants, well, the good applicants and the great really separate. There are so many ideas that are just beyond the stem of the question that you could address. You could talk about the opioid crisis, like I mentioned. You could talk about connections like sickle cell disease. So I'm in the States right now. A big thing is African-American populations are more affected with sickle cell anemia, and it causes them to have pain. And they go to the emergency room. They need medications for their pain. They haven't been diagnosed properly. And they're like, oh, no, this person's just looking for opioids. They don't even give them the time of day to understand what is the source of their pain. You could discuss specific medical cases, like I said, that are maybe relevant to Canada or Manitoba. You could talk about the science of opioid addiction, the receptors, briefly, obviously. Or mention something like your understanding of naloxone training. There's a lot of things you can go beyond this. And this is, when I was like, because I was a reapplicant, the first year I applied, I would give great answers like this. And I'd be like, well, why didn't I get in? I just gave a very solid answer. But the difference really came when I started giving answers like this that made connections, that really stood out. And by the way, these are all questions, the whole PowerPoint, they come from our question bank. So this is our website. This question comes from the opioid crisis question bank in particular. And everything you're seeing here, especially with those ideas to go beyond, are part of our interface. Like we give you the answers to questions like this. So imagine there's 5 people interviewing, only around 40-50% of these Canadian schools will get in. And the way Manitoba's scaled is on a Likert scale. So they'll give you a score of 1 to 5 on how they think you did. 1 being you actually failed. And you can't fail, I think, more than 3 out of your 18 total, or else you'll fail the whole MMI. Okay, but I don't think anyone's failing. But now here's the issue. Like, I don't know y'all, but you're at the stage. You're at the stage where you did well on your CASPRs, or you've done well academically, wrote a great application to get to this point where you're at an interview. So I'm assuming everyone's giving a very good answer to these questions. No one's looking at that and being like, what the heck is the opioid crisis? What are you talking about? They're like, you know what I mean? Like no one is actually giving dumb answers. Maybe like a very, very select few are giving dumb answers, but that's about it. So when everyone's giving strong answers, how do you stand out? And remember, this is what I really figured out. So everyone's doing the same stuff. Everyone's like, okay, let me go listen to this. Let me go read this book. And that's what I did the first year. I'm like, okay, everyone's reading this book. What's it called? Like Doing Right or something? I'm not saying it's a bad book, but I'm just saying if you're going to do the same thing everyone's doing, uh, then you can't stand out. Sometimes it's fine because, the top 40% will actually still get in. But I didn't like those odds. I wanted to be, the top 10, 5%, which is what I had to do to make me get into a school like the Mayo Clinic in the United States, which is a top 10 school, probably in the world. You have to really, really find ways to stand out. And I like this idea of being a lone wolf, like doing your own thinking. They're all reading about like autonomy, non-maleficence, beneficence, like these like ethical principles. But I'm here looking at like, what are the applications of AI in electronic health records? Okay, what is like I'm trying to understand stuff that is beyond the scope of what other people are studying. So this is maybe the most important slide of the entire presentation. These are the 5 ways to stand out. And it's really either you address more perspectives than other people, okay, which certainly demonstrates your knowledge. You offer more creative solutions. So, with the opioid idea, it could have been talking about Manitoba's opioid stewardship policies. They have an online tracking monitoring system. That's the second way. Be a better speaker. So if you can speak very personably, give an organized answer. A lot of people ramble. Okay, a lot of people ramble. And the best way you can improve at that, I'll tell you at the end. Less ums and ahs. People see the camera on their face, and especially on these asynchronous interviews, you see the camera. There's no one looking at you. You just look at yourself, and you're like, and you already look like a goof the second you start because you're not starting with a confident answer. Make connections to your personal life, to your future career, and demonstrate domain-specific knowledge. Okay, so I'm going to give you 3 short examples of these. So personal life, a lot of times I'll be like, okay, opioids. Maybe you've worked in a space where you had to do naloxone administration. Maybe you've done street medicine where you've been with maybe a homeless population. You had to work with themes like that. To your future career, a lot of times when questions would revolve around collaboration, I would say my answer, and then I'd say, collaboration is very important to me, or as a future physician, because I'm going to be working in multidisciplinary teams with a lot of people, part of the healthcare team, providing team-based care to the patient, and everyone has different perspectives. There's going to be conflict, and I'm going to have to work through it and navigate it. So you can connect it to your future career, and specific domain knowledge is literally just mentioning facts relevant to that based on knowledge you have. And lastly, explaining why, because a lot of people just say, well, I would do this. Like, you'd have cool ideas. Like, I would make an app to like track this, but you don't explain why. Why is an app a good idea? Blah, blah, blah. And I really bolded this point because everyone knows some weird dude or gal, okay? Everyone can be weird, who is like the smart aleck. And they're always like rambling, but they try to make themselves sound smart. And believe it or not, all right, and don't quote, like, I didn't say this, but people like this can succeed in these interviews just because they'll look at a camera and say something with conviction. And then the smartest person will look at a camera and then like feel unconfident, or they'll ramble, or they haven't practiced enough, they're not organized. And this dude who's literally saying the most random stuff, because he's saying it confidently at the camera, he's looking at the camera while he talks, he will make it to the next stage. He will get that acceptance, or a high wait list, and the other person won't. Okay, so that's the theme there. Now, this is a question sometimes I get: should you speak for the full time? And the answer is typically no. But when you're doing an asynchronous like this, the answer is yes. So unequivocally, the answer is yes. You will speak for the full time. Try to speak for the full time on your interviews. And should you go in depth or broad? So if there's a question and you can either discuss 1 or 2 ideas deeply, or discuss a lot of ideas broadly, what should you do? And my idea is always to discuss something deeply, but then at the end, I always acknowledge other viewpoints that I might not have had enough time to discuss. Or at the beginning, you know, while other people may think this, this, and this because of those reasons, I believe this, and then I fully explain my thinking. That's how I do it. All right. Are there any questions so far? There are a lot of slides, but I think we're moving through them at a good pace. No questions. Perfect. I must be talking very clearly then. So let's practice with a new question. This is like stuff that's going to hit very close to home with Manitoba health policy. So how does Manitoba's health system address the needs of its immigrant and refugee populations, particularly in terms of language and cultural barriers? All right. Canada's bringing in hundreds of thousands of immigrants every single year. So this is something that you could very well be tested like on these concepts in your MMIs, whether it's the prompt or a follow-up question. And it's pertinent that you understand these topics. So let's look at an answer. I'm not going to bore you through reading the whole thing, but you're more than welcome to read it. But if we're talking about addressing the needs of immigrants and refugees in terms of language and cultural barriers, look at this answer. So the person starts an introduction, and then he or she says, Manitoba has made strides, especially in offering interpreter services through the Winnipeg Regional Health Authority. All right. Immediately, they demonstrate their domain-specific knowledge. So this individual isn't saying some like very broad, okay, Manitoba has like this, like can do this or that. They're showing their exact knowledge of what's going on. But then they go, but here's where we can think outside the box. Telehealth has been a game changer in many aspects of healthcare. Why not leverage it for interpreter services too? Can y'all read? If you can't read, if it's too small, let me know, by the way. But I think if you're full screen, you should be able to read it. So then the individual talks about telehealth, how we could use telehealth to improve access in rural and remote areas. Also, we need to be proactive and not reactive. Let's not wait for non-English speaking patients to show up to emergency rooms. How about we have mobile clinics that go into communities, offering not just medical care, but also health education in multiple languages. So not only does this individual say, okay, this is what Manitoba is doing, but here are some other cool ideas based on like latest technology like telehealth. In addition to language services, Manitoba has established access centers that offer healthcare, counseling, employment assistance, and settlement services. Again, demonstrating their understanding of this province where you claim you're going to want to be here for the next 4 years as a medical student and hopefully for the rest of your training and your life. That's why they're taking you. So you better understand like what's going on in the healthcare scheme in Manitoba. I'm talking to you like Ontario applicants right now, especially. These centers are instrumental in simplifying the healthcare navigation process for immigrants and refugees. So then they talk about, of course, these access centers, and then they say, one thing to consider is tapping into the wealth of knowledge and experience within immigrant communities. How about community health ambassadors? These could be individuals from various cultural backgrounds, trained in basic health education and navigation of the healthcare system. They can act as liaisons between their communities and health services, fostering trust and understanding. Okay, and then there's a conclusion. This is something you could easily say in 3 minutes. If you're someone who has rehearsed, you're acquainted with these ideas, you've been doing your, reading on the news and so on. So everyone go with this. Can I go to the next slide? All right. So yeah, again, we're demonstrating relevant knowledge of Manitoba, showing broad thinking, knowledge of technology, more domain-specific knowledge, and we're demonstrating innovative ideas and cultural competency, okay? And if there's ideas to go beyond, we could talk about things like, we could suggest that Manitoba develops a multilingual app that provides health information and navigation aids. Or maybe like, deploying mobile clinics, offering medical care in multiple languages in community areas, or, collaborating with schools to educate children and families, right? And then there's like, red flags. You don't want to like underestimate like for example, mental health services for these populations, right? All right, now we're going to get into our last section of this presentation. We're going at a very, very quick rate. You know, I respect your time, but I'm impressed. So let's talk about first impressions and how to answer personal questions. All right, so first impressions matter. This is like a big thing about me. Especially for these asynchronous interviews, it's like Casper. The guy doesn't know you or the gal doesn't know you. They just see a video of you and you pop on their like screen. You better start off with with like some hard hitting lines. Okay. If it was a synchronous, I would introduce myself, ask for their name, I'd smile. But here you smile and then you get to work. All right. I would always rehearse the first few words I'd say. So, for example, when I was doing MMI at Queen's University, the first one was asynchronous. During the thinking time, I would rehearse just quickly one time the first sentence I was going to say. So if I stumbled, it didn't matter. I knew what I was going to say. And I would say it with conviction, and I would say it very powerfully. And let's talk about personal questions now, because you could be asked personal questions, whether directly or indirectly. For example, like, what is the biggest challenge you've overcome? All right. And from UManitoba's website itself, the Max Rady College of Medicine, the MMI stations may reflect the CanMed's roles, and they usually do. So the CanMed's roles, I'm not going to bore you. I am gonna throw this at you. This is like the American, the American version of the CanMed's roles: communication, social skills, cultural competency, empathy. It's like 9 different things. I find this very good, and I would always have stories that connect to several of these that I'd have easy, like, that I could pick off the top of my head and just use them to answer these questions. Okay. This is also a very important slide, like these pillars. And let's talk about, like, how do you respond to these questions? And what I use is the STAR method. So the STAR is like, you describe the situation very quickly, the task, what was your responsibility, the action, and then what happened. Don't leave them on a cliffhanger, like, let them know what happened. So in terms of the biggest challenge to overcome, you could start off saying, last semester in the McMaster Bio Society, while organizing a programming skills workshop for first-year students, we encountered an unexpected vendor cancellation, leaving us without crucial materials. Okay, in one sentence, you've quickly described the scene for whoever's reviewing you. And I remember when I started off studying for the MI, I'd have these like elaborate descriptions of what was going on. I had this, my professor was doing this, and I had just come back from school, and I don't know, my shoelace was untied, whatever. And half my time, like if it was a 2-minute answer, and you can run into this issue like on the Casper too, half my time would just be explaining the issue. That doesn't matter. You don't get any points for this. In fact, you don't get any points for S or T of the STAR method. I was tasked with swiftly finding a replacement vendor without overshooting our budget. Okay, so quickly, this shows that I have worked on these stories. I have rehearsed these stories. Sometimes there's details that mean a lot to you, because these are stories that mean a lot to you in your life. But there's details that, if you think of it, does it really add to the story? Obviously it matters a lot to you that you were able to do this or that, but it doesn't talk about who you are or your values or connecting to CanMeds, which is where action comes into play. So consequently, I quickly researched alternative suppliers, assessed their offerings against our needs, and strategically approached the most promising ones to renegotiate terms suitable for our budget. I use strategies like calling suppliers instead of email to ensure rapid communication. So here you're showing problem-solving skills, which is one of these pillars that I'm showing. And also, challenge. This might not be the biggest challenge, obviously, but I'm just talking about, a challenge you could use: resilience, overcoming conflict, capacity for improvement. A lot of stories I see are people that have injuries with sports, for example. And then ultimately, we secured the necessary materials under budget, and the workshop went on without a hitch, earning praise from attendees. This is beautiful. But something I don't see online, and I swear, if you have seen this online, let me know, because I think I invented this. The T. There's a missing T in this method. It should be called the START method. And the T stands for takeaway. So in these personal stories, the difference is the second time I applied, where I got 9 interviews, and I got into top schools in Canada and the US. Like, I got into McMaster in Canada, but in the US was the big one where I'm at right now, the Mayo. I would have like a personal story or a relation to my future profession as a takeaway. And it'll make sense what you want to use based on the story. So you could say like, as I pursue a career in medicine, I will continue to draw on such skills to stay collected in rapidly changing situations. Through strong communication skills, along with problem solving, I will continue to ensure team needs are met for the benefit of my future patients. So this is beautiful. This is like where everyone's just, saying a story, what they did, cool. But you're doing a takeaway. You're connecting it to your future profession. Remember, this is a game where everyone's a great applicant. Everyone deserves that seat at the medical school, but you're competing against each other. It's about who can stand out in the most ways. And that's the game you're playing. So with these personal stories, I've had like 10, 15 personal stories. And I had a medical school friend who is at Queens now, actually. And he said he would have these stories on like a pile of flashcards. And then like the CanMed rules on the other one, on another pile of flashcards. He'd grab a beer, and then he'd like grab two at random and make them connect to each other. Like how can you show like cultural competency or whatever? Sometimes you can't connect them, but it's a fun thought. I never tried that. But all your stories, they should reflect your values. You should try to make them connect to your future career. You should try to connect them to CanMed's items and try to connect them to the medical school. So this is a big one. So I applied to 30 schools in the United States. This is big in the United States because there's so many schools and a lot of good applicants, and it's easier obviously to get in if you are an American, which I wasn't, by the way. They want to know, okay, why do you want to go to our medical school? So especially for you out of province applicants, if you can find interesting ways to tie these stories into maybe the mission of the medical school, or I knew like, sometimes the medical school has certain faculties or programs, or maybe they have interesting like research opportunities or something. Just read into the medical school, understand a bit about it and what they offer to students. So what about the geography is unique? What do you appreciate about the geography? I do recommend this. This is a thing Americans do that I think a lot of Canadians would be good to understand as well. Now, lastly, I'm going to go to some pro tips. All right. So organization. Y'all should really focus on organization because this is about letting your amazing answers get the recognition they deserve. So in the first sentence or two, I would always give an outline of what I would talk about. So I would say like, hello, because this is asynchronous, right? I'm not going to say, hi, my name is Kevin. I'm just going to say, hello. I will begin by addressing the pros and cons of implementing such a public health policy before giving my opinion and then relating it to an experience I've had in the area. So this individual now knows you're going to talk about, okay, the pros and cons, then you're going to give your opinion, and then you're going to hit him with even more. You're going to give him like, it's like their birthday. You're going to give them a personal experience you've had. And you've already stood out before even saying your answer, in my opinion, if you say something like this. So this is why I really value looking at these pillars, okay, look at the CanMed's pillars or these American ones, like whatever you like, and having stories that are relevant to them. And remember, first impressions are critical. And at the end, sometimes if I had time, I'd do a conclusion statement. Sometimes I wouldn't have time. It wasn't the biggest thing. Avoid extreme stances. Obviously, acknowledge every side. Sometimes it's hard, okay? This should go without saying, but if they're like, should pharmaceutical companies be able to provide gifts, right? Sometimes those gifts can be like free samples of their medications. And sometimes those free samples, because Canada doesn't have pharmacare, Canada doesn't provide free pharmaceuticals, maybe the physician can now give those samples away to physicians, to their patients at no cost. And avoid politics where possible. Obviously, some things are political. But always be nuanced with your answers. Zoom out, so the interfaces aren't always the best, especially on the 13-inch screen. So I would zoom out like to 90%. Also, when I was a kid, I read this book called The 7 Habits of Highly Effective Teens. And it told me that the stuff you do before you sleep gets replayed in your brain 6 times more than anything else you did during the day. Now, I don't know how factual that is, but I do believe it to a certain extent. Like, that's why if you cram before you sleep, it works decently well if your exam's in the morning, right? Or if you watch like a scary movie before you go to bed, like you're going to have nightmares. So try not to watch the news. I would always practice right before I slept. So that perspective-taking mindset, the MMI mindset, would get ingrained in my brain. Also, make use of your time. Listen to podcasts while you're at the gym. Okay, don't just like go home in your productive time and be like, I'm gonna listen to this podcast. Like multitask while you're driving to work or something, or to class, or while you're walking to class. And also everyone, again, I'm talking about separating yourself from others. Everyone's like, read this book, listen to this podcast. What is it? The white coat, black art, and the CMAJ, right? The Canadian Medical something journal. I never listened to those. I never read those. But what I would do is I would go like, what's Nature saying about like biotechnology? What's the MIT Tech Reviews? Like, they have a healthcare edition. Read on economics, read on technology, read on finance. Obviously, read on healthcare as well. I'm not saying don't listen to those podcasts. I would go on CBC Health, for example, and understand things. But if you can do things like this, which is what I did, I mean, you're going to stand out automatically because you're going to have ideas that other people don't. Everyone's like a copycat of each other, saying the same answer to the same questions. Then it just comes down to the presentation, how well you're saying your answer. But for me, I wanted to have more innovative ideas, and it really paid off. Okay. Now, I would say share videos of your answers with your colleagues. I'll show what I mean by that. So our platform, and there's 10 free questions. You can go in. So I'm just going, it's kind of like a UWorld. So you go to like the medicine MMI question bank. There's 103 questions. Let's do some like policy questions, okay? And we're going to do a test, and you're going to give yourself just like the hardest questions you get. Just 2 minutes to read it, and then 2 minutes to answer. You're going to create your test. Boom, boom, boom. What are the benefits and risks of using technologies like AI and robotics in medicine? Do you think that these tools will ever replace the roles of physicians, right? You have 2 minutes to think, and then you can begin your response. You can answer to the camera, okay? And once you're done, and then you can save your video, and you can send it off to your friends. And then you can study the answers or, ideas for your answers. There's like Da Vinci robotic surgery that's going on, Neuralink. Talk about how policy could be relevant to AI, right? And there's a lot of questions, medical schools, should they use standardized test scores or focus more on activities? What's, legal market for selling organs? There's like a lot of policy topics there. And practice. There are so many topics: colonization, generational trauma with the residential school system, social determinants of health, so many different topics, the housing crisis in Manitoba. You need to be reading up on these. You need to have this, and obviously I'm going to send this to you. So I think this is a pretty cool list I made, by the way. So like use this as a list to study, but also go beyond. And before the Q&A, I want to show you, like we also do have a mini question bank on Manitoba health policy, where we have questions like, how would you address the challenges faced by rural healthcare facilities in Manitoba in terms of the physician shortage and resource allocation? So we have this, LGBTQ health in Manitoba, for example. Given the limited healthcare budgets, how should Manitoba prioritize its spending? And then it says, a report by University of Manitoba says this, and we've done a lot of the research for you in one place to help you, save time, which is something I wish I would have had. And everything comes with these ideas to go beyond, red flags to avoid. And once you're done looking at Manitoba health policy, you can look at social determinants of health, the opioid crisis, AI in health, telehealth. You can look at other provinces if it interests you. We have British Columbia, and we have Ontario, and so on and so forth. So that's the presentation, y'all. Are there any questions for me?